There are many people all over the world struggling with weight loss and weight loss maintenance through different diets. But today, my main focus is on intermittent fasting, which is all about when to eat. Hello, I'm Dr. Mitra, and today I'm going to talk about one of the most interesting topics of weight loss, and that is intermittent fasting. If you have ever heard about intermittent fasting or you are struggling with which dietary pattern peak for weight loss, so please listen more carefully to this video. There's a contrast between intermittent fasting and normal pattern of eating in which you eat throughout the waking hours. When we have 3 meals a day plus snacks and no exercises, what happens to our body? It actually consumes the calories we've taken, and it doesn't use our fat stores to produce energy anymore. The mechanism of weight loss behind intermittent fasting is that your body consumes the calorie you had taken in your last meal. But before going into detail about intermittent fasting, first we should know the difference between calorie restriction, which is a common strategy in weight loss, and intermittent fasting. In calorie restriction, there is a reduction in daily amount of calorie you take. For example, as an adult, if you take 2,000 calories a day, you reduce it to 1,000 in order to lose weight. But intermittent fasting is a pattern in which for certain periods of time, you're dedicated to take no calories or very little calorie. For example, this fasting time can range from 8 hours to 12 hours or even more. So it has a fixed duration and drinks are consumed regularly. And the interesting fact is that it has been found to more likely mimic human eating patterns. Our ancestors practiced fasting due to food scarcity. They had to starve for several days in order to find the prey. Nowadays, there are several methods of fasting that can be used in practice. Some of the most common include alternate day fasting, in which every other day you go and fast for 24 hours, and in next one, you eat regularly for 5 days, and then you reduce your calorie intake to amount of around 500 to 600 for 2 days in a week. You can also pick a daily approach. For example, you go and fast from 6 hours to 8 hours or even 12 hours, and then you can eat. Apart from different proposed methods for intermittent fasting, the important thing is to know what mechanism is behind this method, which leads to weight loss or brings about other health benefits. During prolonged fasting, fat from adipose tissue is converted to fatty acid and glycerol and then metabolized for energy. For weight loss, the onset of metabolic switch is the point of negative energy balance at which liver glycogen stores are depleted and fatty acids are metabolized. Then our liver converts these fatty acids to ketone bodies, which will be the main source of energy for most of the tissues in our body and especially our brain during fasting. The metabolic switch from glucose to ketones represents shift of metabolism from fat storage to consumption of fat as the main source of energy. And it also preserves both muscle mass and its function. But how practical intermittent fasting is in today's life? An argument in favor of intermittent fasting is that it has various protocols, so it can be much more adaptable than other dietary patterns like ketogenic diets, vegan diets, or calorie-restricted diets. It also coordinates more with our circadian rhythm, so it can be a more physiological diet. In one of my videos, I talked about body clock and its effect on metabolism, so I recommend you to watch the video for more information. But is it just about weight loss? Intermittent fasting brings about several other health benefits, such as thinking and memory, heart health, like blood pressure and resting heart rate, and type 2 diabetes. But is it safe for everyone? Intermittent fasting is not recommended for those under 18, women who are breastfeeding or pregnant, and people with type 1 diabetes who take insulins. While there are clinical trials indicating that intermittent fasting is beneficial in patients with type 2 diabetes, but there are no studies confirming this result for type 1 diabetes. Keep in mind that intermittent fasting has different effects on different people. So before starting, especially if you have underlying disease, consult with your doctor. And after starting, if you have any unusual symptoms such as anxiety, nausea, vomiting, or any other symptoms, please again consult with your doctor. Hope this video has been useful for you. Please like, comment, and subscribe my channel for more videos like this.